right, you guys, this is the last chapter on the kidney, or the urinary tract, genitourinary, I suppose. So let's get through this, disorders of urine elimination. Some of this is going to be the same that we talked about with kidney disorders, but that'll be okay. You know that the bladder stores urine and helps to control the elimination process, okay? It's also known as the urinary vesicle. Of course, I've never heard anybody say, oh, how is your urinary vesicle? We always talk about the bladder. So remember, the kidneys control the formation of urine and regulate body fluids. The bladder stores that urine and helps, again, to eliminate. It's divided into two parts, the fundus and the posterior urethra. The fundus is known as the body. The urethra is known as the neck. And if you just remember how the bladder looks, that makes perfect sense. Urine passes to the bladder through the ureters, close to the base of the bladder, near the urethra. And again, I think that you should go back and look at your anatomy and so you can understand how everything works. It makes it a lot more sensible. There are 4 layers of bladder structure, starting with the outermost layer, which is the serosa layer. Then you have your detrusor muscle, which is also the muscle of micturition or the muscle of passing urine, okay? When the detrusor muscle contracts, urine leaves the bladder. Very important muscle there with urine elimination. Then you have the submucosal layer, which is loose connective tissue, and then the innermost layer of epithelium, which serves as a barrier between the urine and the blood. Other important muscles of the bladder are the internal and the external sphincter. There's a good diagram on page 576 if you want to look at that. It'll make a little bit more sense. The internal sphincter is basically a continuation of the detrusor muscle. And remember, we said when the detrusor muscle contracts, urine passes. So as that muscle contracts, the internal sphincter opens up and allows urine to pass through. Now, the external sphincter is a circular muscle or circular muscle fibers, and the external sphincter works to stop urination. And this is what helps us stay continent and keeps us from, wetting ourselves all the time. So what controls bladder function? Well, you've got control from the autonomic nervous system, which is your involuntary control via your parasympathetic and sympathetic nervous system. And then you have voluntary control through the somatic nervous system. The sympathetic nervous system works by promoting bladder filling, okay? So if the bladder is filling up, then you know that the internal sphincter is contracting, okay, at that time, okay? Now, don't let that get you confused. When the detrusor muscle contracts, the internal sphincter will open up and allow urine to pass, okay? But the sympathetic nervous system works to promote bladder filling. The parasympathetic nervous system works to empty the bladder, okay? Empty the bladder, and causes relaxation of the internal sphincter. The somatic nervous system is what gives us voluntary control of urination through that external sphincter, those strong muscle fibers. And this is why, when you go on long trips, you can say, okay, I kind of need to go to the bathroom, but I'm going to hold it. I can hold it. All right? So, and that's through the voluntary control of that external sphincter muscle. If you look on page 577 at the figure 26.2, you'll see that the number of nerves that supply the bladder and the urethra. And that shows you that if you have spinal cord injury or nerve damage, what an effect that can have on your bladder control and function. Now, acetylcholine is a very important neurotransmitter that plays a huge role in the function of the autonomic nervous system in regards to urine control. Now, something that's not listed on this slide but that you need to know is that the pontine micturition center, or the pontine urination center in the brain, is somewhat like the director or the coordinator. And basically that center gets input from reflex centers in the spinal cord and coordinates activity of the detrusor muscle and the external sphincter. So it all works together via that pontine micturition center and then all the many nerves that run through the spinal cord. I used to talk about children and bladder control, but we're not going to hit on that today or even be tested on that, because you'll get that when you get to pediatrics. There are several different tools or tests that are used to evaluate bladder function, and one of the main ones is post-void residual. And basically, it shows you how well your bladder is emptying. Okay, so if you go to the bathroom and then they put in a catheter and check how much urine was left in your bladder, if it's less than 50 cc's, then we say that your bladder is doing a pretty good job of emptying. If it's greater than 200, then, not so much. Your bladder needs to empty out pretty much all of the urine that's there, except for about 50 cc's or so. So let's talk about some alterations in bladder function, starting with obstruction and then talking a little bit about incontinence. Urinary obstruction and stasis is when urine is held in the bladder because there is some type of obstruction keeping it from passing through. It can be in the bladder neck, it can be in the urethra, it can be in the external meatus. It can be partial obstruction or it can be complete. It can be a problem that you're born with, or it can be something that you acquire, such as benign prostate hyperplasia in men, which again, the prostate cells increase in number, squeezing off the urethra and causing obstruction there so that urine can't pass through. Certain sexually transmitted diseases like gonorrhea can actually cause urinary obstruction because of the inflammation that occurs there in the pelvis. Bladder tumors, fecal impactions, and constipation can actually cause obstruction as well and affect urine passing through and being excreted. So you have to watch that. Just like anything else, if urine stays in the bladder for a long period of time, it's at risk for developing a bacterial growth and an infection. And the number one bug that you see, again, that causes a urinary tract infection or a bladder infection is E. coli, just like we talked earlier when we were talking specifically about the kidney. Now, when there is an obstruction and a decrease in urine, then the body is going to try to compensate for that obstruction and actually increase capacity in the bladder with hypertrophy, okay, making the bladder try to get a little bit bigger so that it can hold more urine. The only problem with that is you'll start to have bladder contractions that are so strong, sometimes they even spasm, which is why somebody who has a bladder infection or an obstruction has feelings of urgency, even sometimes to the point of incontinence. They will actually pass a little bit of urine through that obstruction because the bladder spasms are so strong. Along with that, the detrusor muscle can actually get so tired that it doesn't empty completely. That is what gives you the feeling of frequency or having to go to the bathroom so often, because you're not actually emptying your bladder completely because of the obstruction. Now, if you have significant obstruction enough, like we've already talked about, then urine can flow back up into the ureters and into the kidney, causing kidney damage or renal failure. And we've already talked about that before, so we won't go into detail on that. Some signs of urine obstruction and retention or retaining urine. Your bladder will distend, and actually you can palpate the bladder on somebody who is distended. Hesitancy, meaning that they can't start a stream of urine, or they have to strain to initiate the start of a stream of urine. It may be weak or small. They may have to go to the bathroom very frequently. They may feel like they are not emptying their bladder completely. And again, they may have a little bit of incontinence because their spasms are so strong that they actually push a little bit of urine out beyond the obstruction. So that brings us to urinary incontinence here, which is a big problem for some people. And we're not talking about the occasional, I laugh so hard that, you wet your pants. This is what we're talking about here is frequent incontinence, and it's divided into 3 subgroups: stress, urge, and overflow. Now, overflow incontinence we talked about as a result of urinary obstruction, which leads to urgency, frequency, and the fact that you just spasm so hard that you push out a little bit of urine because of your urge. We're going to talk a little bit more about stress and urge incontinence now. Stress incontinence is when you lose urine involuntarily, when you laugh, cough, sneeze, or do some heavy lifting. And again, this is not just your occasional, I'm laughing so hard that this happens. It happens every single time that you cough or you sneeze. And it happens anytime activities increase your intra-abdominal pressure. If you increase your intra-abdominal pressure, you also increase bladder pressure, and it causes urine to leak out. Usually, most of the time, because the pelvic muscles are very weak. Very common in women who have had vaginal childbirth, or even just the normal aging process and the weakening of the muscles. Pelvic surgeries can cause the same problem. Men can actually have stress incontinence after they've had prostate surgeries or radiation or chemo. There are some surgeries now that they can do to help with stress incontinence. They'll actually go in and repair or try to lift up those muscles to try to make them a little bit stronger. And there's medications that they can try, and then some different muscle exercises to try to increase the strength of the muscles in the pelvis. Urge incontinence is a little bit different. This is just a flat, overactive bladder. And if you've seen, you watch TV, you see the commercial, I gotta go right now. And these people just have to go to the bathroom all the time. They don't necessarily always have incontinence with it, meaning that they, leak urine, but they just have to go to the bathroom all the time, even during the night, which is very, it's kind of a pain. So they have urgency. They have to go a lot. When they need to go, they've got to go right now. They may have a little bit of burning. And then nocturia, again, which is the urination at night, which is very bothersome for some people. Again, they may or may not have incontinence. It's not all the time. It's mostly the overactive bladder and the fact that they can't do anything because they have to go to the bathroom so frequently throughout the day. Most of the time, they have contractions, and they may have problems. It kind of correlates along with some neurogenic disorders like people who have had stroke, Parkinson's disease, multiple sclerosis, things like that have damaged the nervous system a little bit, and again affects the bladder. And then different myogenic disorders like diabetes and things along that line. Bladder cancer is the most frequent form of urinary tract cancer in our country. It's 3 times more common in men than women. Ranges anywhere from low grade to high grade. People who have a lot of bladder stones and bladder infections tend to have an increased risk for bladder cancer. And then those people who are exposed to certain carcinogenic agents that are excreted in the urine and may be stored in the bladder, such as dye, textile, rubber industry, and paint as well. Those people are at increased risk. Signs and symptoms of bladder cancer. Number 1, highlight it, painless hematuria, painless blood in the urine. Remember I told you, same thing with renal cell carcinoma or kidney cancer. It's the same with bladder cancer. If somebody comes in and they have bleeding or blood in their urine and no pain, that's a big thing that needs to be checked out, along with they may have just some frequency and urgency as well. Treatment, they can have surgery, chemo, and radiation. And the prognosis is not too terribly bad here, again, if it's caught early enough. Last but not least, we've got the neurogenic disorders of the bladder, and this is when you have an interruption in your neural control, the nerve. There's a nerve problem. Maybe it's in the peripheral nerves, maybe it's in the spinal cord, maybe it's in that pontine micturition center in the brain. It can be anywhere along the central nervous system. The first one is spastic bladder, and with spastic bladder, there's a failure to store urine, okay? Your bladder, the muscles spasm and contract so much that you can't hold in a lot of urine, so you're not storing urine. This can be caused by spinal cord injuries, herniated discs in the back, tumors, things along that line. But anyway, spastic bladder, the bladder is spasming so much that you cannot store urine up in the bladder. Flaccid bladder is when you can't empty the urine, okay? We can fill it, we can store it, but we don't empty it. This happens sometimes because of peripheral nerve damage, like with diseases such as diabetes mellitus. This happens. Remember, we talked about how your nerves were affected in your lower extremities. Same thing here in the bladder vessels. But basically, you're not emptying the urine. So know the difference there between spastic and flaccid bladder. Spastic bladder, you're not storing urine. Flaccid bladder, you're not emptying urine. Where's my backpack? Sorry about that. Looking for a backpack. And that's it. The focus here is on the spastic bladder. You know, obviously, a lot of times those people have to do self-catheterization a lot of the time. Same thing with flaccid bladder, because you don't want to over-distend the bladder. You're at risk for UTI and renal damage. So a lot of times with either one of these neurogenic disorders, you have to self-catheterize every so many hours so that you're getting rid of that urine and protecting yourself and your bladder. So that's it.